My name is Dannine. I'm going to be your nurse today. Can you tell me your full name?
Devin Clark,
And can you tell me your date of birth?
May 28th, 2004.
Do you know what month it is?
April,
Do you know who the current president is?
Donald Trump.
And what did you do this morning before 8 and 10? Do you know?
I was sleeping.
Okay. Right now, are you taking any current medications?
No,
And that would be including over the counter, any herbal supplements, vitamins.
no,
Do you smoke cigarettes?
no,
Do you have any history of smoke, meningitis, or spinal cord injury?
no,
Do you take any illegal drugs?
no,
Do you drink any alcohol,
no,
caffeine?
no,
Do you have any dizziness,
no,
seizures, tremors, or muscle weakness?
No.
Nothing you'd like to report that's recent or that you haven't noticed before?
no,
Do you have any incoordinations, like you feel off kilter, numbness or tingling anywhere?
no,
And how about your joints? Do you or your family have any history of any bone or muscle or joint pain?
no,
Stiffness, swelling, or redness in any parts of your body?
mm-mm,
How about any limitations on movements?
no,
Do you have any cramping during rest or when you're moving, or any issues that would bother your activities of normal living,
Yeah.
getting up in the morning, those types
No.
of things? Do you have any deformities?
no,
Do you suffer from any types of pain in your back or anywhere else?
no,
Do you work in an environment that could be hazardous to your health?
no,
Are you ever around chemicals that could bother you, like neurologically,
mm-mm,
that you're aware of? Do you have any difficulty swallowing, speaking?
No.
How about any double or blurred vision?
no,
Have you or your family been diagnosed with any abdominal conditions such as ulcers, pancreatitis, hepatitis, ulcerative colitis, or colon cancers?
no,
Any surgeries to any part of your abdomen?
mm-mm,
And how do you feel about your current weight?
good,
Do you feel like you eat a well-balanced diet?
yes,
Do you ever eat out of boredom?
sometimes,
And what's your go-to for that? What do you like to eat?
goldfish,
And what type of beverages do you like to consume?
water,
How much water do you think you drink on a daily basis?
a lot,
Well, that's good.
yeah,
Do you have any food sensitivities or allergies?
no,
And how about to any medications, any allergies that you know of?
mm-mm,
And what would a typical day of eating be for you? Like 3 meals, snacking?
yeah, probably like 3 meals, 2 snacks or something like that.
And do you feel like you have a healthy appetite, no decreases recently?
No.
And what do you normally like to have for breakfast, lunch, and dinner food-wise?
For breakfast, I like having bagels or eggs. For lunch, I like having anything that's in my fridge. And for lunch, I like eating whatever my mom makes
Okay.
for dinner.
And have you ever gotten any food stuck in your esophagus, or you feel like you have any difficulty swallowing?
No.
And how about any nausea, vomiting, abdominal distension?
Mm-mm.
No burping or over flatulent? You don't have any pain in your abdominal area after eating?
No.
And your bowel movements, would you say they're normal for you?
Yes.
And how often would you say you have a bowel movement?
Like once or twice a day?
And do you play any sports going to school?
Yes.
When you're playing your sports, do you wear a helmet?
Yes.
And when you're in the car with friends or your parents, do you wear a seatbelt?
Yes.
Okay, let's get started on your physical. I'm just going to check some of your cranial nerves.
Okay.
If you could just close your eyes and let me know what you smell. I'll be checking for cranial nerve number 1, which is olfactory. Can you smell that?
Yes.
And that smells like what to you?
Flowers.
Okay. And now for cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. We're going to do the 6 cardinal. You're just going to keep your eyes fixed on this and move your eyes as it moves. Okay. And now I'm just going to have you look straight ahead. Just keep your gaze straight ahead. Good. Nice. Your pupils are equal, round, reactive to light with accommodation. going to check your trigeminal nerve. I'm just going to put my hands on here. Can you open and shut your mouth? And clench your teeth for me. Do you have any pain or discomfort when I'm feeling your
No.
joints in here? Okay, very good. They're equal in the strength bilaterally. All right, we're going to just check the nerves of your face. You shut your eyes. I'm going to touch you with a cotton ball, and you just let me know where it is.
On my left cheek. On my right cheek. On my chin. On my forehead.
Very good. You can open your eyes. I'm going to check your facial nerves. Can you smile? Can you frown? Can you lift up your eyebrows? Puff up your cheeks? Very good. Now we're going to check for acoustics. I want you to hold one hand over this ear. And I'm just going to whisper something. You're going to tell me what it is.
1, 2, 3.
Can you do the same with this ear over here?
Sure.
You ready?
1, 2, 3.
That's very good. Now we're going to do your glossopharyngeal and your vagus nerves. So if you could open your mouth and say ah. Your uvula and your palate. Move up and down symmetry and stick out your tongue. Your tongue moves very well. I'm not going to make you gag, but can you swallow for me?
Mm-hmm.
And you don't have any problems with swallowing movements?
No.
Okay, your swallowing was good movement. Now we're going to check your accessories. Those are your shoulders. You just relax, shrug your shoulders up and down. No discomfort with that?
No.
Go against me this way. Just one at a time.
Oh, sorry.
There you go. That side is good. Do this side. That is also good. Okay. We're going to just do some of your reflexes while you're sitting here.
Okay.
I don't have the specific hammer for this, but that's okay. We're just going to go with what I have and see how it works. I'm just going to check your reflexes on your knees. That's good. That's a +2. Just relax. It's okay if it doesn't go on its own. Okay, just put your arm in here. Like I said, I don't have the hammer on your long shirt, so. Yeah, that was a good one. Okay. And now I'm going to check you for some sensory. This would be considered a sharp side, and this would be considered the dull side. So you just put your sleeves up just a little bit and close your eyes, and you tell me if you feel dull or sharp.
Dull. 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 Sharp. Sharp. Sharp.
I'm going to move to the other hand.
Dull. 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 Sharp. Sharp.
And go down to your feet.
Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp.
Very good. Now, for one last part on this, I'm going to ask you to walk across the room. When you go this way, can you just walk regular? But when you come back, we're going to do heel to toe.
Okay.
Go ahead. Very good. Have a seat. And now we're going to move on to the musculoskeletal. For this, we're going to check all your range of motion, and we're going to be checking for your strength. You just sit up nice and tall. I'm just going to feel around. You don't have any soreness, muscle aches up and in this area. You don't have any swelling, any joint discomfort, nothing like that.
No.
And you feel like you have pretty good range of motion on a daily basis. Okay, can we do chin to chest, and then back, and then side to side, and then ear to shoulder? Do you have any kind of pain with any of those movements?
No.
Nothing at all. That's great. All right, we're going to can you stick your arms straight out in front of you? We're going to put them behind your head. for extension. Then we're going to put them behind your back for rotation, and you don't have any discomfort when you're doing that.
No.
And can you lift them over your head and put your hands together? Okay, that's very good. Can you bend your arms just like this? I'm going to resist you. Try to push against me. And here I'm going to try to pull your arms down. You're going to push them back. Very nice. And I'm going to have you hold your arms out in front of you. We're going to palms up for supination. How does that feel?
Good.
No problems. Palms down for pronation. Very good. And I'm going to check your wrist. You don't have any pain or discomfort in your wrist?
No.
No swelling, nothing like that? That's great. Can you flex your wrist down for flexion? Up for dorsiflexion? And can you go back and forth with your wrist? You don't have any discomforts when doing that?
No.
Can I see your fingers? Can I see both hands? Hold your fingers out and in, out and in. Do you have any discomfort when you're doing any of these movements? No. Nothing at all?
No.
I'm going to come down to your legs.
Okay.
Hang them down. I'm going to push against them. You resist me. Push back. Now I'm going to pull them out again. I'm going to push down on your feet. You push up. And then you're going to pedal down. Do you have any discomfort when you're doing any of those movements?
No.
No. Okay. Can I have you stand up?
Sure.
Just going to have you stand right in front of me. Now for your feet, can you put your feet out? And can you put them in? Can you do the same to the other foot? Out and in. You don't have any discomfort with any of those movements?
No.
How about in your hip area? Do you have any tightness in your hips?
No.
We're going to do an extension and then internal. Can you lift out and then cross over your foot? Any discomfort?
No.
You do the other leg, out and cross over with your foot. No discomfort. Okay, so we said that we didn't have any discomfort in your hip area.
No.
Can you lean forward and
Sure.
just kind of curve your back? I just want to check your spinal column. Make sure that there's no S curve. It would be for scoliosis. And again, you have no discomfort in any range of motion, right?
No.
Okay, so now we're going to go to the abdomen. Would you mind laying down over here on the table? Okay, you can scoot up a little bit. And we're just going to cover you up for privacy. Would you mind if we just look at your stomach? Okay, first I'm going to just inspect the area, and it's very flat in contour. I don't see any scars or lesions or bulges. You don't have any discomfort in your abdominal area.
No.
Okay, and then I'm going to auscultate, starting with the right lower quadrant and going clockwise, checking for bowel sounds, 15 seconds each quadrant. Now I'm just looking for an aortic pulse in here, and we're going to turn around the stethoscope to use the bell and listen for any bruit in the aorta and in the renal areas. And in the femoral. And I don't hear any bruits. Okay, and now I'm going to percuss for tympani, which I should hear any place where there is not an organ. And I'm just going to lightly do that in a clockwise motion. You're not having any discomfort?
No.
Okay, now I'm going to just do a light palpation. And now I'm going to do an even deeper palpation, feeling for any masses, bulges. You don't have any pain in any of the areas in which
No.
I'm palpating. If she had pain in an area, I wouldn't be doing a deep palpation there. If she came in for like an appendicitis pain, I could check for a rebound pain, which would be pushing down and then releasing, and that would be the Blumberg pain scale. And also, you can also check for appendicitis by lifting up the leg and turning it out to the side. No discomfort with that?
No.
Okay. We'll do it on this side. That's where the appendix is. Okay. Thank you so much for coming in today.
Thank you so much.